Alright, let's talk about traumatic brain injuries. So the definition is an injury to the brain caused by an external force that produces either a diminished or altered state of consciousness, coma, and either temporary and or permanent impairment in cognitive, physical, social, and behavioral functioning. So just a few facts. There are at least 10 million TBIs annually that result in hospitalization or death. Most of them occur in men between the ages of 15 to 24, probably because they're risk takers. TBIs require immediate stabilization at acute care facilities. Most of them you'll be taken to the ER. And after receiving a traumatic brain injury, the risks go up for alcoholism, epilepsy, depression, and PTSD. So, majority of people who receive a brain injury are treated in an emergency room and released. But a lot of them have to be hospitalized, and a good number of them die from their injury. So you can look at those statistics. And in younger children, there are also some statistics there about how many TBIs occur annually and the results of those. And the leading causes of traumatic brain injury, so the number one is falls. The second highest cause is just, well, it's a range of causes, so I guess I don't really include that. But like traffic accidents, being hit by something or running into something, and there are also assaults. But a lot of us probably know of people who've received traumatic brain injuries from either like car wrecks or like skiing accidents or things like that. So the Glasgow Coma Scale it rates 3 different responses, and the higher the score they get, like the better score they get in the eye-opening response, verbal response, and motor response, is like the better shape they're in. A severe TBI is going to be in the range of like 3 to 8, and mild between 13 and 15, and moderate in the middle of that. But you can look at those and you can kind of see how each of them would. I lost my train of thought. Anyway, look at those, they're great. So for a mild brain injury, you're going to experience headache, fatigue, sleep disturbance, irritability, sensitivity to certain things. Your balance will probably be a little bit off. You won't be able to like think or speak as quickly as before. Struggle with some memory problems, nausea, like from getting concussions and things like that. Depression, anxiety, and mood swings. For moderate brain injuries, you'll see loss of consciousness, longer periods of confusion, some physical, cognitive, and behavioral impairments, which may last for a few months or they might be permanent. And those people can make a generally good recovery with a lot of treatment. They won't be necessarily back to how they were before, but they can still function well and learn to compensate. So severe brain injury, sorry, I'm like shaking the camera. Okay. A severe injury occurs when prolonged unconscious state lasts for days, weeks, or months. So we're talking about a coma. they are in a vegetative state and they're having to stay in the hospital for a period of time. They're barely responsive. But some tips to aid in recovery is to definitely get rest. After receiving a brain injury, the last thing you want to do is hit your head again or be super active. So get lots of rest. Avoid driving and like doing other things that you might not be as good at because you received the brain injury. Because your judgment and decision making is going to be a little bit off. Take only medications that your doctor has approved. Absolutely stay away from alcohol until your doctor says it's okay, because that can make it worse. You can write down things if you have a hard time remembering. And you can get help to relearn skills that were lost. So these are some of the physical and emotional impairments that can result from a traumatic brain injury. There are a lot of them. I'm not going to read all of them, but you can look at those there and see them in your handout. Also, some cognitive and social impairments. So traumatic brain injury it affects a lot of things, a lot of aspects of your life, especially the more severe it is. Some functioning characteristics. So levels, you'll see levels 1 through 8, all the way from no response to comatose, up to like completely functioning independently and behaving appropriately. So with the Rancho Los Amigos scale of cognitive functioning, we can see the different types of therapeutic recreation that we can use depending on what level they are and how well they're functioning. So with those who are comatose, it's going to be very simple things: sensory stimulation, passive range of motion, music. As the stage increases to a low arousal stage, we'll also do sensory stimulation, some orientation, and cognitive retraining. Levels 4, 5, and 6, post-traumatic amnesia stage, we'll do leisure education, aquatic therapy, table and board games, orientation, and community integration. And then the highest levels, 7 and 8, the post-confusional stage, so where they're doing well, do memory books, community integration, social skills training, computer games, virtual reality, leisure resource awareness, relaxation, and stress and anger management. So that's helpful to look at if you're dealing, if you have a client who's been through a traumatic brain injury, to use that and see what activities are appropriate for them. And those are sources.